Okay, good afternoon, everyone, and thank you for joining us for our last scheduled session for 2021. But we're pleased to announce today that because of the overwhelming success, we will be continuing this series, the virtual hereditary cancer series. And starting in January of 2022, we will be offering these virtual sessions again, and we're really trying to be responsive to what you wanted to hear us talk about. And so in relation to what you have provided us in the evaluations, we have planned a very exciting series for 2022. So please keep your eyes open for your email or check back on our website, and you can start to register for those in the next few weeks. But today I'm thrilled to be able to introduce Emma Rinaldo, who is our social worker at Women's College Hospital. She's a registered clinical social worker and a psychotherapist. And for the past 7 years, she's worked in clinical settings, including the neuro-oncology program and the family therapy training program at Sick Kids Hospital. And she's currently in the Peter Gilgan Center for Women's Cancers at Women's College Hospital. Some of you may have had the opportunity to meet with Emma. She offers supports to individuals and families who are managing acute or chronic health conditions, such as a cancer diagnosis, or individuals who are at a high risk of developing cancer. So Emma is very experienced in terms of the topic that she's going to talk about today. She's also going to become a mom in the next month or so. So we're very thrilled that she was able to squeeze this in before she goes off on maternity leave. So Emma, I'm going to leave it open to you. And just a reminder to everyone, if you have questions as we go along, please enter them into the question and answer little icon at the bottom there. And at the end, Joanne Katsopoulos and I will go through those questions and ask them for you. So I'm going to turn off my camera and my microphone, and I will leave it up to you. Thank you so much, Emma.
Thanks, Kelly. Hi, everyone. It's nice to be here today. And just as a bit of a disclaimer, I am expecting, so I will be out of breath. Baby is deciding to sort of kick my ribs today. So I'm sort of experiencing that breathlessness. So if you do hear that, that's what that's from. Okay, so we'll start with the topic today, which is BRCA and your family. And this is a guide to talking with your children about carrying a BRCA mutation. So some of the goals of the session today. So we're going to be learning several aspects of discussing familial mutations, like the BRCA 1 or 2 with your family, including how to assess parent readiness, how to assess child readiness, considering things like timing, communication, and the environment. The hope is for you to become a bit more aware of your own comfort level when discussing familial mutations with your family. We'll take some time to process the impact of a BRCA mutation on yourself and your family. You'll learn some strategies to help make these conversations more effective and comfortable. And we hope that you'll receive a bit more support and guidance from professionals and current research. So really the session is intended as a guide to help individuals who are preparing to discuss a familial BRCA mutation with their children and family members. So the overall goal of the session is to provide you with a bit more information that will help inform these discussions in order to make them as comfortable and as effective as possible. And the session content is informed by individuals that I see or have seen in my professional practice, as well as from what the recent literature is showing. So let's start at the beginning. Some of the reasons for pursuing genetic testing. So you may have been encouraged to get tested to help with decisions about cancer treatment or prevention. The decision to get tested may have been made quickly or considered for a longer period of time. Some have chosen to get genetic testing for the benefit of their children or family. And some have a strong family history of cancer or other family members who have already been tested. Really, whatever the reason is, the timing and the circumstances surrounding your testing may influence your thoughts, your feelings, and your decisions around talking to your children and family about the BRCA mutation. So we're going to look at what the literature is saying. And I think it's important to bring in this information from current research because it really does help normalize things. We know that having a conversation about BRCA with your children or family members can be difficult and often distressing. So I think it's good to see that the literature supports this, and hopefully you feel a little bit less alone. So what are parents and caregivers saying in the literature? Parents are describing moral and ethical conviction as motivation to communicate with family members. There's cultural beliefs, fear of stigmatization, and desire to protect relatives from worry and stress, and those can act as barriers to communicate. Parents are experiencing mixed feelings about their moral duty to share important information versus the need to protect children from the impacts of the information. Some parents consider their children too young to understand and want to avoid causing them unnecessary anxiety. Parents would like support to decide when, if, and how to share information and what their reactions are, what they should expect from their children. Parents are struggling with a balance, and they're struggling to balance a respect for keeping children informed about health risks in the family with a desire to protect them from potentially distressing information that their children may not be cognitively or emotionally prepared to receive or able to medically act upon. Overall, though, what is the literature saying right now in terms of considerations for having discussions? Having knowledge provides opportunities for prevention and early diagnosis of future primary cancers in individuals and biological relatives. Knowledge of their parents' genetic tests could provide an educational opportunity about adopting healthy behaviors. For example, sometimes conversations with female teenagers about the associated risks and benefits of oral contraceptive use, or parents providing opportunities to discuss healthy lifestyle, like avoiding and quitting smoking, alcohol consumption, eating a balanced diet, staying physically active. And even though children may experience worry and concerns about their health and the health of their parents, research generally showing that greater open communication is associated with higher levels of children's emotional and psychological resiliency. And this is over time, right? As well as adaptive responses to their own inherited risk. And the way in which information is communicated and received may emotionally color much of the way the child feels about hereditary cancer risk in the years to follow, and may also affect the tone of the future parent-child communication about this topic. So really the overall theme is, communication is important, and it's something that the research supports. So some of the gaps and unmet needs that are sort of coming up in the research is providers delivering the BRCA genetic counseling should support needs regarding communicating genetic test results to at-risk relatives, including children. And parents are needing support from healthcare providers to communicate balanced risk information to children in developmentally appropriate manner. So the hope is today that we'll be able to provide a bit more support in terms of considerations for having these discussions. So planning a conversation, and I call it a conversation because this isn't a one-time thing. This is an ongoing conversation or a discussion with your children or your family, right? Discussions may be planned, they may be unplanned, they can happen in stages over time. I encourage you not to worry about getting it perfectly right the first time. The reason for and the timing of your own genetic testing may influence your thoughts and decisions around talking to your children. And then I encourage you to really consider your own family, right? Every family is unique. So finding a path that works for all of you. So now we're going to take a little bit of a deep dive into assessing parent readiness, parent or caregiver readiness. And remember that readiness can come in stages, okay? So it's not like you have to feel 100% ready to have this conversation. You might feel a little bit ready, but it's always important to sort of consider, do I have all the correct up-to-date factual information? Do I feel generally comfortable and confident to have a talk? Do I feel emotionally prepared to share the information with my children? And importantly, are my children ready emotionally and or developmentally to receive this information? So Women's College Hospital, we created a bit of a guide, and the guide centers around questions to consider when you're thinking about your own readiness. So if you look at the top of this guide, it says here, I'm ready to talk to my child about the BRCA gene mutation. If you think, yes, I'm ready. This is sort of a general checklist, right? You might feel a few of them, some not as much, and that's completely okay. So you're just looking to feel generally ready. You may not ever feel 100% confident in having this talk. But some of the things to consider. I have reviewed my own understanding about BRCA mutations. I feel comfortable and confident that I have accurate facts about how BRCA may affect me and my family. I have spoken to a genetic counselor or other healthcare providers and have up-to-date information. And as best I can, I feel emotionally prepared to handle my child's reactions and questions. If you're feeling like, I'm not sure, I might be ready, or I'm not ready, that's okay. So I ask you to consider sort of these 4 ingredients. What do you need to know to feel ready? Looking at sort of emotional support, right? Seeking support is very normal for many people. You might need more time. You might need more time to process the impacts. I just really encourage you to go easy on yourself. A lot of emotions can rise to the surface. Take the time you need to process the BRCA related impacts before you have a conversation with your children. Again, it's not a talk you want to rush. And there are ways that, we'll go over later on in this PowerPoint, some ways to sort of, process the impacts. But, think about reaching out to family, friends, healthcare providers for additional support. Personal readiness. Again, you might need more time and practice. You might need more time to process. Sometimes a helpful tip, and I recommend this in my practice, is practicing the conversation with a family member or friend or member of your team, or if you do see a social worker. Sometimes it helps to be able to talk this out loud. Child readiness. So here, I encourage you to think about your child's personality. What kind of kid are they? Where are they developmentally? Is this the right time for them to have a discussion? Assess what they might already know, right? We know that children are very perceptive, so sometimes they know more than we think. Consider using developmentally appropriate activities to encourage communication, depending on where they are. That could be through art, through storybooks. I also encourage you to consider accessing supports available to your child, sometimes including a teacher in the conversation or sort of after the facts, just so that they have that additional support. And then most importantly, is to trust your intuition. So you know your child the best. Is this the right time for them? And then the 4th ingredient is around more factual information. So, everyone has that sort of initial talk with a genetic counselor. And we all know that, sometimes those talks can provide a lot of really great information. And if we're finding out that we have the BRCA mutation, then, it can be quite distressing. It can be overwhelming. And sometimes we might hear some information, we might not hear all of the information. So, I do encourage you to, consider, maybe I don't have all the correct information. Maybe I don't know everything. and maybe I need to circle back, talk to a healthcare provider, maybe meet with a genetic counselor again, a primary care provider, or a GPO in the high-risk clinic. Or you can gather credible information from reputable sites like FORCE or the National Society of Genetic Counselors. So we're going to look here at emotional preparedness and processing. Again, this is a really important piece because if you don't feel like you have taken the time to process the impacts of finding out about BRCA mutation, it's hard to feel confident in having a discussion. So I like to, in my practice, encourage people to reflect on some of these questions. And people do it in different ways. Some people like to talk out loud to themselves. Some people like to answer these questions in a journal format. Some people like to talk to a partner, family member, friend, healthcare provider, finding out what works best for you. So take a look at some of these questions. How have you been shaped by your experiences with a BRCA mutation? How have you been affected by cancer in your life? How do you feel about having inherited the BRCA mutation? If the thought of passing on a BRCA mutation overwhelms you or fills you with guilt or sadness, it may be important to address these feelings before talking to your child. And just remember for your own peace of mind and in speaking to your child that genetic inheritance is random. So we cannot choose which genes are passed to our children. And it's not influenced by lifestyle or any other choices that we make. So thinking about these questions is a big step, right? It's a first step towards being emotionally prepared to talk about BRCA with your children. Sometimes people may feel the need to have the conversation quickly, just want to get it over with, which I understand. However, I do suggest that you pause and you take time to process the impacts, become aware of your own feelings, right? We know that thinking about passing on a BRCA mutation can lead to complicated feelings, guilt, sadness, anger. And just remember that processing our emotions, gathering information really is an ongoing process. You may always feel a mix of emotions, and that's completely normal or okay. We're not looking for you to feel, joyful or happy or completely ready to have this conversation, right? I always say that, you can have multiple feelings living in the same space, right? You can feel confident and ready to have a conversation, and you might also feel some feelings of guilt. You might also feel, a bit nervous or feel fearful of having the conversation. Again, that's completely normal and okay. So we're going to look at another guide, and this is around assessing your own comfort level. How do you know if you're comfortable having the talk? So these are some signs of comfort and discomfort. And again, we're not looking for you to feel all of these signs of comfort. You might feel a mixed bag. You might feel some signs of comfort. You might feel a bit uncomfortable. What we're really looking for is just, more signs of comfort, right? And if you're sort of noticing, okay, I'm feeling a little bit discomfort, where do you feel discomfort? And, that's really where you should sort of focus your processing on, where, focus your time on in terms of, what do I need to feel a bit more comfortable? Do I need to get more information? Do I need to speak to somebody about it? But again, I don't think anyone ever feels fully comfortable having the discussion. We're just looking for a little bit more around feeling a bit more comfortable. So some of the signs of comfort. I feel calm when I talk about the BRCA mutation. I feel positive about the medical decisions I have made. I am confident that we do what we can to avoid cancer. The future holds more promise than the past. I believe that knowledge is power. And I feel confident that my children can handle it. Some of the signs of discomfort. The thought that my children inherited the mutation is unbearable. I feel very emotional when I think about my children's futures. I try to avoid thinking or talking about it. And I often feel worried, guilty, fearful, or angry about my family's BRCA mutation. So here I just ask you to consider your need to share the information compared to your child's need to know at a particular time, right? If you feel upset or very upset by the information, it may not be the right time to present it to your child. And just give yourself a break. You may need more time, you may need a bit more support, and that's completely okay. So now we're going to shift gears and explore a little bit around child readiness. So we're going to look at some of the general principles. Children value being included in important conversations. We know that children are very perceptive, right? Children are observant and they can sense their parents' feelings. They may feel left out if they're not included in important conversations. And they often know when important conversations are happening and they're not included. It's important for children to get information honestly, in plain language, and from the source. Your children would prefer to hear this important information from you. And research shows that children are likely to be upset when communication is not open. And sometimes without accurate information, children may actually form their own faulty beliefs, right, in order to explain events or, whatever it is that you are sharing with them. Sometimes those faulty beliefs can lead to feelings of distress or anxiety. Many children are aware of important issues from an early age. So an advantage of actually discussing the BRCA mutation from an early age, as it does allow for sort of the gradual understanding of information over time. And just keep in mind that all children are different, right? With varying intellectual abilities, emotional intelligence, and communication preferences. They also have lots of different life experiences. Some might have been exposed to cancer and loss. So just sort of keeping that in mind in terms of what do they already know. And then this piece here, I wanted to include, children who are adopted or conceived through donor gametes or surrogacy will require a modified version that's focused on parental risk. So let's look at some of the communication guidelines. And here we're sort of considering the general developmental stages. And these developmental stages will help guide and approach the discussion. So your child's age and developmental stage will impact their understanding of and response to important information that you are sharing. So if we look at elementary school age children, and this is ages 6 to 12, they're gaining new skills. They're building relationships with friends. There's a strong emphasis on rules and fairness. And they might actually hold a belief that thoughts have power to cause illness. So consider your own child. If fairness is a focus for your child, it might be helpful to say something like this. All families have genes that affect their risk of getting certain diseases, like heart disease or diabetes or cancer, and many families don't know what those genes are. So knowing there's a risk factor for cancer in our family has some advantages because we can take steps to lower our chances of getting cancer. Adolescents, and they're typically age 13 to 18. They have that sort of combination of intellectual maturity combined with emotional immaturity. They're becoming a lot more independent, developing a unique adult identity. There's a strong importance of peers and friends. There's a distancing from family and physical development. So an example of inconsistency between intellectual maturity and emotional immaturity is that an adolescent may understand intellectually that they're not at risk for developing cancer at this age, yet they might still feel anxious about sort of future risks. So it may be a good time to review healthy behaviors that your child can learn now to help provide them or arm them with a sense of control over some of the long-term health risks. Early adulthood. This is 18 plus. This is a major transitional time. They're gaining independence, responsibility, at the same time, sort of still needing a little bit of family support. And this is the time when many will actually choose to get tested themselves. So I would just encourage you to remind your young adult child that seeking support while they get tested is not a sign of dependence, but that you can be there for each other. So just a reminder that throughout all of this, each child is unique, right? You know your child the best, right? As well as each family's needs and issues are unique. So there's no, right or wrong time or age to introduce BRCA information to your child. However, it is recommended that you do discuss this information with your child by the time they are 25. Some screenings and cancer risk management would begin at that age. But for those families with members who have been diagnosed in their mid-20s, the BRCA mutation discussion should occur at an earlier age. Okay, and then here I just encourage you to be strong and positive when speaking to children, and just stress how lucky you feel to be empowered with information that can keep you healthy. So starting the conversation, and just remembering that communication is a gradual process, right? It evolves over time. It doesn't need to be done in one conversation. And that communication really does create more trust and confidence. So some of the things to consider are when, where, and who. So where would you like the first conversation to take place? The car, the dinner table, on a walk. When is it, weekdays or weekends? And ask you to sort of consider what's going on for your child that may influence that timing. Are they having exams? Are they having peer issues or relationship issues? So sort of considering those things when you think about having this discussion. Is the conversation going to be, you alone, or is it going to be with your partner or a close family member or a friend? If you have more than one child, will you be talking to them together or separately? And if it's separately, consider how information will be shared between the children. And then, this is an important piece here. So learning from past experience with sharing difficult news. Typically, there might have been an experience where, your child has had to deal with something. So think about how they dealt with it, right? How does your child take in information? How do they handle tough stuff? How do you typically support them if they feel worried or troubled? Or, how do you know if they feel worried or troubled? So some of the communication guidelines that I like to follow here. So looking at your child's cues, and this is important, right? Paying attention to body language. Are they turned away from you? Are they looking at you? Are they maintaining eye contact? How do you know if they're listening? Allow them to indicate how much or how little they want to know at one given time. We know that, children have short attention spans, so just considering that. Keep it simple, particularly if they are young, right? Use clear language and age-appropriate terms. Welcome questions, and it's okay to not know the answer. We know that all questions are good questions, right? So questions might come immediately, they might come days later, they might come weeks later, they might come months later. So sort of expect that at any time. I wouldn't expect all the questions to come at once. Sometimes children take time to sort of process information. Children learn as much from what we do as what we say. So your child will look to you as a role model for how to handle difficult information and challenging situations, and they will take your lead. Correct common myths. So misunderstandings are common, right? Particularly for, a topic like this. Be prepared with correct factual information. And if you don't know, you can just say, we'll find out together. And that's often helpful because then children feel like they're part of the process. Evaluate the impact of a conversation. So again, you might not know how much they understand. Back to children don't have, long attention spans. So they might hear some of the information. They might not hear all of it. So ask your child to repeat back their understanding, and it's okay to ask them questions. Checking in frequently. It is a conversation, and again, it can be ongoing. And then I wanted to add this piece here that if you are not in contact with your child, to consider making written information available to them, either sent directly to them through a family member, a lawyer, or an agency. So now we're going to shift again to, thinking about talking to other family members or extended family members. And often people in my practice, come to me and say, I don't really know where to start. I don't know who to tell, who needs to know. So, I think it's important to separate the two. Consider who needs to know about the BRCA mutation, and then consider who you would like to tell. And this is important because who needs to know, are the people that might need to consider getting tested, and who you would like to tell are, your support network. So the people who are able to sort of support you through it. And I encourage people to make two lists, one of people who need to know and one of people you would like to tell. And that just helps you sort of, get out of your head and sort of put it down on paper. What if my family doesn't want to talk? And we do see this does happen. So your views and your family's views may not align. We know that every family is different. Not everyone will have the same reaction. So you can encourage people to share their feelings, but don't force a conversation to happen. They might need more time, they might need more information. You could also make written information available to them, like a link to the National Society of Genetic Counselors or the FORCE website. So this is another guide that we developed here at Women's College, and this is a fillable activity guide that might be useful to help you map out general conversations, themes, and ideas. Again, you don't need to do this. It's just a general guide. And it's divided into different categories: before the talk, getting the talk started, recognizing emotions, questions your children may ask, and checking in after the first talk. So this is just an example of the first page, and it asks you to fill in the spaces below and check boxes that apply. So before the talk, by the end of the first talk, I would like my children to feel, I would like my children to know. Who would be the best person to share the news about my BRCA mutation with my children? I will share the news, or blank will share the news. When do I think the BRCA mutation should be shared with my children? Now, in a few months, in a year, or more. When is a good time? Mornings, evenings, weekdays, weekends. Where do I want to have the best conversations with my children? I'd like the first talk to take place blank. Again, this is a guide, so feel free to, use it, or, sometimes it just helps sort of map things out. So this resource, a couple of the resources will be available after this talk is finished, after about 1 o'clock. An email with a survey link will be sent out after the presentation. In this same email, you'll also see a link with direct access to these resources. So some other resources to consider. If you are followed in any of the high-risk clinics at Women's College Hospital or FOCC aftercare clinics, you have access to social work support. So you can please ask your provider for a referral. Similarly at other hospitals and other high-risk clinics, you can do the same. So asking genetic counselor, healthcare providers about connecting you to supports. Force, which is Facing Our Risk of Cancer Empowered, often has a lot of good resources and up to date on current research. The National Society of Genetic Counselors, Bright Pink, which is an organization for young women at high risk for breast and ovarian cancer. Your family doctor or general practitioner oncologist, a GPO, might have additional resources. And then community therapy is another option. So, psychosocial oncology providers, health psychologists, social workers, or other mental health professionals, and just asking your healthcare provider if they are aware of BRCA-related supports. So these are some of the references. And now we are at the question portion. So I'm just going to stop my screen. All right.
Unmute myself. Thank you so much, Emma. I think it's really helpful to hear some of those. And I suspect many of those recommendations could apply to any health condition or any gene, right? So now that we're testing more genes than just BRCA1 and 2, would it be the same type of conversation?
Exactly the same.
Okay. And there was also a question in the question box, and I encourage all of you now to please type your questions in and we can ask them to Emma for you. But there is a question about for individuals who have a strong family history, but there hasn't been a genetic mutation identified.
Mm-hmm.
Would that be different, a different type of conversation?
Oh, not necessarily. I mean, I think, for those individuals, like they're often still, in the high risk programs, right? So I think it's still an important conversation to have. And, those individuals might have, a gene that they don't know about yet, right? So I think it's still important to have those conversations and, obviously a little bit different, but, I think it is generally important for people to know if they still are in the high risk category.
Mm-hmm.
Mm-hmm.
Okay.
So I'm just looking through the questions here. What about talking, and this is what about talking to if you have boys versus girls? And do you change the way you present the information? I know for their own personal risk, yes, but talking to sons and may also have younger daughters.
Mm-hmm.
How about that conversation?
I mean, I think it depends on their age, right? And developmentally, like I think, it's a bit more general when they're younger. And I think as they get a little bit more older, I do encourage people to, I'm not a medical professional, so I do encourage people to really reach out to genetic counselors or healthcare providers to talk about sort of the differences between, male risk versus female risk. But, I do think, they're part of the family just as much, and there's still risk for men as well. As well as considering, them having children in the future as well. So I think having those conversations are equally as important.
Maybe this is more like a personal question. Are there ever instances where someone might approach you and say, and I don't know if this is something that people can do, can you speak to my family with me? Like have a social worker present or somebody in your team present when they are talking to them?
Yeah, sometimes I do. I do encourage people to try and, have the conversations sort of as a family unit, because sometimes if you do bring someone on, like a healthcare provider or a social worker, the conversation, the tone becomes a little bit more serious. It's almost like, what's wrong? Why are we all here? So, really the first step would be to, can we practice the talk, right? Before you have a discussion with your children, can we think about, where your comfort level is? What are some of the questions that, you can ask? Sometimes practicing the talk and thinking about, where are there gaps in knowledge? Do you need more time to process? That's sort of more around my role. If I haven't actually had, a family discussion with people, because I've I feel like people have been able to sort of work through some of the stuff, and then, they might circle back and say, this is sort of what happened. How do I approach this? And then I sort of help guide them through it.
And I know you kind of talked about resources, but the video that Emma and her team created is a really great resource. I know it lives on the Women's College website and the YouTube channel. So it's something really I encourage you all to listen to. It's a very easy video and guide to speaking to your family.
Mm-hmm. It's pretty much what I just did right now with a little cartoon.
But the cartoon is cute.
The cartoon, yeah.
There's an interesting comment on the questions as well, and I think it's not uncommon in families where you see some individuals who want testing and some who don't, and the dynamic that creates in a family. And I know that wasn't the topic of your discussion today, Emma, but could you just touch on that about how family members may want to handle that, or
yeah, I mean, it's tricky because not everyone's views will align. So really my responsibility is to the person that I'm seeing. So I'll support them really around what's gonna help you sort of manage this, and then provide recommendations around how can you potentially support the other individual in their decision, and just helping them sort of understand that not everyone's going to have the same perspective. Everyone's different. They might end up making a decision, to get tested 5 years down the road, and that's really, that's their decision to make. You can only do so much. So I think it's again around, working with, the person that I'm seeing around how to navigate that and how to navigate, having those conversations. Sometimes I encourage them to present, credible information, to their family member so that their family member has the information. Sometimes that's all you can do.
Mm-hmm. And I think you did pick something up that was really important as well throughout your talk, and it's about being prepared and knowing the latest information about BRCA or whatever the other gene may be. And I think for some people who may have been tested 20 years ago, we've learned so much from that. And I think most of you who are attending these seminars really can appreciate how much we've learned within those 20 years. So it may be worth a revisit to your genetic counselor to get that information on what this mutation means for you, what it may mean for your children or family members, so you can go into those conversations very prepared.
Yeah.
Sorry, just to reiterate, and that's something that we have been stressing, I think, throughout the conversation and all the seminar series, is that it's important to keep engaged with your genetic counselor or whoever's providing you care, because things have been changing quite a bit in the last decade.
Yeah, and I think, in my practice, a lot of the distress and anxiety that I see comes from, people not feeling like they have all of the information. Again, like I said in the talk, having one conversation with a genetic counselor just doesn't cut it. No. And, when you have any sort of, meeting with a healthcare provider, sometimes it can be overwhelming and there's a lot of information that's coming at you. So I really do encourage people to reach back out to their genetic counselor or, healthcare provider in the high-risk clinic and sort of talk about, I just need a bit more understanding around my own risks and what it means for me and my family. I might need a bit more support around talking to my children. I might need more information around A, B, and C, whatever it is. It's all questions are good questions. And I think, that's something I really.
And you're right, because, finding out you have a mutation is a big deal. And that one meeting is not enough to understand, and things change over time. And if you find out you're a mutation carrier at 20, you might have some time to think about some things versus whether you're a mutation carrier identified at age 50. Mm-hmm. And so it's not just a one-time appointment, it's an ongoing commitment. And
just like the conversation with your children, it's the exact same thing. It's not a one-time conversation. You feel like I'm, one and done. I've spoken to them about it, or I need to rush into it. It's let me take the time I need to actually gather all the information, make sure I'm, processed this and I'm ready, as ready as I can be, and, kind of go from there.
Mhm. And often we have moms or dads coming back to see us in our genetics clinic when they have questions about how their adolescents should be managed, especially in relation to the use of oral contraceptives. That's often a question that we get from parents about talking to their children about the use of oral contraceptives and the implications that may have. So that's also sometimes when we see parents coming back to the genetics team to get the most recent information on how they should be talking to their children about appropriate use of oral contraceptives and what that might mean.
Yeah.
So again, another reason to come back and visit your genetic counselor.
Yeah.
And when possible, that was why we put together these seminars, because the information is evolving and it's sometimes hard to find out what the correct evidence is. So it's great that you're participating in these seminars too for the audience.
Yeah.
And we're trying to tailor the questions to more timely conversations.
I do see, a lot of, people sort of come in and say, well, I know that screening starts at 30. So, I'm really going to wait until, they're just before 30 in order to, encourage them to go through the process. But we do know that, depending on, family history and depending on, if there's been people in their family who've been diagnosed in their 20s, right, their screening might start a lot earlier. So I think that's another reason why I encourage people to go back and have conversations with, their healthcare providers, genetic counselors, just so that they know, when is the best time for my family? When is the best time for my kids?
That's great.
Mm-hmm.
Okay, thank you, Emma. Or were there more, Joanne?
No, I think that's everything. I mean, a lot of people shared their own, experiences talking to adult children and just reiterating what you've talked about, which is great. Talking to boys also, not just girls or daughters and sons. So then there's questions about more webinars. So we are going to continue our webinar series, but this was the last one for this year, and we're going to continue in late January. A lot of the topics are going to be based on the feedback we received from the audience. So please continue to provide us the feedback and questions, because we're trying to tailor the questions to what the audience wants to hear also. And so there's going to be a little bit of a different format, but it's still going to happen once a month starting January. So we're going to hopefully be advertising sometime in December. And if you've contacted us and been a part of any of these seminars, we'll have your emails and you should be getting a notification.
And I would also remind everyone that this session was recorded. You may have family members or partners who would benefit from hearing Emma's talk and how to talk to children about many different health conditions. I don't think it's just all related to genetics. So it could be helpful for many different types of discussions that you need to have with your children related to health. So I would encourage you, this will be posted on the website. So please share if you think it would help someone who needs help in terms of how to have conversations with their children.
Yeah, and the video again is really great.
Yeah.
A great start to that conversation.
So, all right.
Emma,
thank you so much.
Here. That was very informative.
And good luck with your baby.
Thank you. Thank you for having me.
Okay.
Okay.
Thank you, everybody,
for attending. It's been another great seminar. We're very, very happy with how things went this last year. And Joanne and I are committed to ensuring that these seminars continue. The feedback that you have provided us has been excellent. And we will continue to offer these seminars as long as there are people that we think are using this information, and please continue to give us your feedback. So fill out the questionnaire, the survey that you're sent, and let us know what we can do differently or what you like us, how you would like us to keep it the same. So please provide us with that type of feedback. All right.
Thank you, everybody.
Have a great weekend.
Bye,
Thanks so much.
See you later. Bye.